Good day everyone. We are the group 4 and we will be discussing about the clinical symptoms and disorders of the skeleton. I am Joyce Malta together with my group mates John Shiley Lumactod, Yam Andrea Mainit, Steven Lacambra, Prince Rodney Magudayaw, Angela Manuel, Irish Jimenez, and Jasmine Ladaran. So first is ankylosing spondylitis. It is a chronic, progressive inflammatory disease involving the spinal joints and surrounding soft tissue, most common in young males and also known as rheumatoid spondylitis. So the breakdown of the word spondylitis in medical terminology is spondyle pertains to spine or vertebrae and itis pertains to inflammation. So basically spondylitis is a type of arthritis that causes inflammation in the joints. Next is arthritis. So I know that we are all familiar with the word arthritis. So the breakdown of the word arthritis in medical terminology is art or arto pertains to joint and itis pertains to inflammation. So basically it is a inflammation of a joint. It is caused by a fault in the immune system that causes the body to attack its own tissue in the joints. Next is chondrosarcoma. The breakdown of the word chondrosarcoma in medical terminology is chondro pertains to cartilage, sarc or sarco pertains to tissue, and oma pertains to tumor. So basically, it is a malignant tumor of cartilage. When we say malignant tumor, it is the tumor that contains cells that grow uncontrollably and the cartilage is a strong, flexible connective tissue that protects your joints and bones. It is also the so called shock absorber. Next is the curvature of the spine. It is an exaggerated spinal curve. As we can see in the picture, there are different types of spinal curves. First is scoliosis. We are all familiar with the word scoliosis, right? Scoliosis is the sideways curve that makes the spine appear S-shaped or C-shaped. Next is kyphosis. It is an abnormally rounded upper back. And lastly is lordosis. It is the inward curve at the lower back. Next is the degenerative joint disease or DJD. It is also known as osteoarthritis, the most common form of arthritis. Next is fracture. The most common definition of fracture is a break in the bone. In a closed simple fracture, the broken bone does not penetrate the skin, while in an open fracture, there is an accompanying wound in the skin.
Now, let's start with gout, or also known as the disease of kings or king's disease. So, ano nga ba ang gout? Gout is a common form of inflammatory arthritis characterized by recurrent attacks of painful joint pain. When this happens, it is called gouty attack. A gout attack occurs suddenly, often at night. The affected joint is swollen, red, and warm to touch. The initial attack usually involves only one joint, and kadalasan sa big toe yung naapektuhan and naglalas ito ng ilang araw. So, ano nga ba ang common or possible causes ng gout? Okay, gout is caused by deposits of urate crystals in the joints, which may happen when blood levels of uric acid are too high. Na in medical term, it is also known as hyperuricemia. Uric acid is a waste product na nabubuo sa pagbe-breakdown ng purines. Ang purines naman ay major component of DNA and RNA. Because body cells are constantly renewed, uric acid is constantly produced and removed in urine. So, nare-remove siya through ihi natin. For men, ang normal level ng uric acid sa dugo ay 2.5 to 7 milligrams per dl. And sa kababaihan naman ay 1.5 to 6 milligrams per dl. Sa hyperuricemia, it's either ang body natin ay makakapag-produce ng sobrang uric acid or it could be the kidney's decreased ability to excrete uric acid. Normally, our kidneys' function is to filter urates from our blood along with other wastes and excess fluids. So ayun, yung kidneys natin ang tumatanggap at nagsasala ng halos lahat ng mga waste na nanggagaling sa ating dugo. And it is necessary for our kidneys to effectively excrete these urates through our urine. So, kapag sobra ang urates sa dugo or kung may damage ang ating kidneys at hindi siya makapag-function na maayos, these urates can result in kidney stones or it madedevelop siya sa different parts of our urinary systems. Usually, kadalasan sa mga nakararanas or nagkakaroon nito ay ang mga nakatatanda. It rarely occurs in younger people, and according on the researches, napansin nila na mas common at mas maaga itong nadadiagnose sa mga kalalakihan, usually between 30 to 45 years old. For women, gout is usually diagnosed when they are around 45 years old. Common din po ang gout sa mga taong 65 years old pataas. Also take note guys, na ang pagkakaroon ng gout and high level of uric acid sa blood can be hereditary or namamana. Next, we have here the herniated disc. A herniated disc, also called a slip disc, is a medical condition that affects the spine, in which the fibrous outer portion of the intervertebral disc ruptures or tears, allowing the soft, jelly-like central portion to squeeze or bulge out. So kapag nagkaroon ng rupture sa part ng intervertebral disc na yon, pwedeng lumuwa or mag-bulge out ang malambot na bahagi at makaipit ito ng nerves o ugat na nagkakos ng pain. The spinal column is made of 32 bones known as vertebrae stuck into each other. Accordingly, the column includes 7 bones in the cervical spine, followed by 12 bones in the thoracic spine and 5 in the lumbar spine, followed by 5 fused vertebrae in the sacrum and 4 fused vertebrae in the coccyx at the base. Each vertebra is separated from the adjacent vertebra and cushioned by an intervertebral disc. The disc helps to protect the bones by minimizing the impact of movements on the spinal column. A herniated disc can occur in any part of the spinal column. They are common in the lumbar spine, just above the hips. A herniated disc can compress nearby nerves, resulting in pain, numbness, or weakness in arm or leg. What are the possible causes of herniated disc? Disc degeneration can often be the result of a gradual, age-related wear and tear termed degenerative disc disease. As people age, the intervertebral discloses its water content as well as the ability to cushion the vertebrae. This reduction in fluid makes the discs less flexible and more prone to rupturing even with a little twist or bend. In some cases, disc herniation may occur in young and healthy people as a result of injury or tear from lifting large heavy objects. Certain factors that may increase the risk of a herniated disc may include excess body weight, genetics, an occupation that is physically demanding, or sedentary lifestyle. So let us now proceed to our next topic, which is the kyphosis. Kyphosis is an abnormal anterior-posterior curvature of the spine with forward convexity and dorsal prominence. Kyphosis is also called as the hunchback or slouching posture. There are three main types of kyphosis. The first one is the congenital, next is the postural, and the third type is the Schumann's kyphosis. Congenital kyphosis is the rare type. It is caused by the abnormal development of the vertebrae prior to the birth. Ang postural naman is the most common type of kyphosis. It is commonly seen in females than in males, which is mainly noticed in the adolescent girls. It progressively gets worse by the age. The symptoms will be the pain and the muscle fatigue. And lastly, we have here the Schumann's kyphosis. It is also mainly seen in the adolescent age and is a result of structural deformity. It commonly develops in addition with the scoliosis. There are some other causes for kyphosis, which can be the muscular dystrophies, TB spine, polio, and spina bifida. The next one is what we call the lordosis. Similar to kyphosis, lordosis is also an abnormal anterior-posterior curvature of the spine with forward convexity or the inward curvature of a portion of the lumbar in the cervical vertebral column. Lordosis can be seen in the poor posture, congenital vertebral problems, physiologically in the pregnancy, neuromuscular problems, and surgery to the back or the hip joint. In children, rickets may also lead to lordosis. The next one is the osteoarthritis. Osteoarthritis is the world's most common joint disease. The causes can be varied. In some people, it is a joint positioning problem that they are born with or develop early in life. In others, it can be due to an accident. In most, however, it is due to many years of unbalanced physical efforts. All joints can be affected, sometimes several at the same time, but it most commonly affects the hands, hips, and knees. Let's take a closer look at osteoarthritis. Our bones support our body weight and are exposed to force each time we move. Every bone in our body sits in a joint. This is what a healthy joint looks like. However, if you have osteoarthritis, then the knee joints look more like this. It all starts with damage to the surrounding cartilage. If you don't do anything about it, it will just get worse. The friction it causes irritates the inner surface of the joint and leads to painful inflammation. The joint line shrinks, the bones move closer together, and the first damage to the ends of the bone starts. This is what we call early stage osteoarthritis. If no treatment is given, the cartilage layer will continue to get thinner. It can take years, but we can see in the image how the bones are directly pressing against each other and therefore clearly damaging each other. This is late stage osteoarthritis. The joint gets wider and the ends of the bones can rub together, which results in limitation in movement and even more pain. Next, we have here the osteogenic sarcoma or osteosarcoma. Osteosarcoma represents one of the most common primary tumors of bone. Even though ang bones natin ay magkakaiba when it comes to sizes and shapes, still they are all made of the same types of cells and the primary one among them are osteoblasts. Osteoblasts, yung nagbi-build up ng new bone, and osteosarcomas arise from osteoblasts of different sizes. And these cells produce too much osteoid tissue, which is the unmineralized organic portion of bone matrix that forms prior to the maturation of bone tissue. This is why osteosarcoma is called a bone-forming tumor. Most cancer of this type happens in children and young adults, especially teens, but osteosarcoma can develop at any age. Typically, it starts in areas where the bone is growing quickly, such as near the ends of the leg or the arm bones and often near the knees and shoulders. When older adults develop osteosarcoma, it typically happens in the hips, shoulders, and jaw. Let us now proceed to the last topic, which is the osteomalacia. Osteomalacia is a condition that causes bones to soften due to a lack of vitamin D. It can cause bone pain and tenderness with even slight pressure causes a lot of discomfort. It also increases the risks of bone fractures, makes walking difficult, and weakens the muscles.
Osteomyelitis is inflammation of the bone and bone marrow caused by infection, usually bacteria. So, osteomyelitis is a serious bone infection typically caused by bacteria, often entering the bone through a wound or blood stream. This infection leads to inflammation, pain, and can result in bone damage. Osteopenia, a lower than average bone density, which may foreshadow. So, osteopenia is a condition characterized by lower than normal bone mineral density, which makes bone weaker and more prone to fractures. It is often considered an intermediate stage between normal bone density and osteoporosis. Osteoporosis, a condition characterized by reproduction in bone density, most common in white women past menopause. Predisposing factors include poor diet, inactivity, and low estrogen level. So, osteoporosis is a chronic disease in which bone density and quality decrease over time, causing bones to become brittle and susceptible to fractures, particularly in the hip, spine, and wrist. It is most common in the postmenopausal women. Next, we have Paget disease. Paget disease is a skeletal disease of the elderly characterized by bone thickening and distortion with bowing of long bones. Osteitis deformans. So, Paget's disease of the bone is a chronic disorder that affects the normal remodeling process of bone tissue. It results in the formation of enlarged and weakened bones, leading to pain, deformities, and an increased risk of fractures. Next, we have Pat disease. Pat disease is inflammation of the vertebrae, usually caused by tuberculosis. So, Pat disease or spinal tuberculosis is a form of tuberculosis that primarily infects the spine. This infection can lead to vertebral destruction, spinal deformities, and neurological symptoms due to compression of the spinal cord. Rheumatoid arthritis is a chronic autoimmune disease of unknown origin resulting in inflammation of peripheral joints and related structures, most common in women than men. So, rheumatoid arthritis is an autoimmune disease that primarily affects the synovial membranes in joints. It causes inflammation, pain, and can lead to joint damage, deformities, and disability if not managed effectively. Next, we have rheumatoid factor. Rheumatoid factor is a group of antibodies found in blood in case of rheumatoid arthritis and other systematic disease. So, rheumatoid factor is an antibody found in blood of some individuals and other autoimmune diseases. It is used as a diagnostic marker for these conditions, although not all individuals with rheumatoid arthritis test positive for it.
Rickets. Rickets are faulty bone formation in children usually caused by deficiency of vitamin D. It is often noticeable in ages of 6 months and 3 years. Parts of the skeletal structure that rickets can impact are long bone, spine, pelvis, chest, skull, and joints. Sciatica. Sciatica is a severe pain in the leg along the course of the sciatic nerve, usually related to spinal nerve root irritation. One of the most common cause of sciatica is herniated disc in the lumbar spine or lower back and may also be caused by trauma or injuries such as fall and car accidents. Scoliosis. Scoliosis is a sideways curvature of the spine in any region. There are many types of scoliosis, and idiopathic scoliosis is the most common of them all. Idiopathic scoliosis can develop in children to adolescents during their growth spurt. Spondylolisthesis, a forward displacement of one vertebra over another in the spine. This condition occurs in the lumbar or cervical regions of the spine. This disorder can be present from newborn to adults. It depends on the specific type of spondylolisthesis. Spondylosis. Spondylosis is the degeneration of the articulating portions of the vertebra allowing for spinal distortion, specifically in the lumbar region. This is commonly associated with overuse or repetitive stress of the spine, such as those experienced in sports or activities that involve frequent hyperextension of the lower back. This condition is often considered a precursor to spondylolisthesis, where one vertebra slips forward over another. Other causes of spondylolysis are genetics, trauma, or congenital. Achondroplasia: decreased growth of cartilage in the growth plate of long bones, resulting in dwarfism. Achondroplasia is typically diagnosed shortly after birth or during infancy, as the physical characteristics associated with the condition become more apparent during the early stages of development. Achondroplasia is related to limbs, spine, facial features, hands, and feet. Baker's cyst. Baker's cyst is a mass formed at the knee by distension of the bursa with excess synovial fluid resulting from chronic irritation. The primary symptom of a Baker's cyst is a visible swelling or lump at the back of the knee. Other symptoms of Baker's cyst are pain and discomfort in the back of the knee, particularly when the knee is extended, stiffness in the knee, limited range of motion. In some cases, the cyst can rupture, leading to sudden swelling and pain in the calf area. Baker's cysts can be diagnosed in various ages, but are commonly seen in adults at the age of 40.
Bunion, or also known as hallux valgus, is the inflammation and enlargement of the metatarsal joint of the great toe, usually with displacement of the great toe towards the other toes. The location of bunion is at the base of big toe, and the cause of it is the pain, discomfort, and swelling, making it difficult to wear socks or other footwear. Next, we have bursitis. Bursitis is the inflammation of a bursa. Bursa is the fluid-filled sac cavity that counters friction at joint, located between bone and surrounding soft tissue. The cause of bursitis is the pain in the affected linkage, which can be aching or sharp, and the location of it can be through our hip, knee, elbow, and shoulder. Next, we have the carpal tunnel syndrome. Carpal tunnel syndrome affects the wrist and hand compression of the median nerve as passes the carpal tunnel, narrow passageway in the wrist formed by bones and connective tissue. The cause of carpal tunnel syndrome is the lack of sensation and pain in our thumb, index finger, middle finger, and our ring finger. And the location of it is through our hands and fingers. Next, we have chondroma. Chondroma is a benign tumor of cartilage that is slow-growing development of abnormal cartilage cells in various parts of the body. Although this tumor is a non-cancerous type, but it can cause symptoms of pain and fracture. The cause of chondroma is the overgrowth of the cartilage that lines the ends of the bone, and we can be located through our bones such as the arms and legs and our soft tissue. Soft tissue includes the skin, muscles, or tendons. Next, we have the Ewing tumor. Ewing tumor, or also known as Ewing sarcoma, is a rare and aggressive form of primary bone cancer which primarily affects children at the age of 5 to 15 years old. And this tumor often grows in the bone and soft tissue that are connected to the bone. The cause of Ewing tumor is the chromosomal changes in a cell's DNA and can be located through our long bones, which is the arms and legs. Next, we have exostosis. Exostosis, or also known as osteoma, is the bony growth that protrudes from the surface of the bone. This develops from the existing bone tissues and can also be observed or found in various parts throughout the body. The cause of exostosis is the injury or chronic irritation of a bone and can be located through our skull, spine, vertebrae, and long bones. Next, we have giant cell tumor. Giant cell tumor is uncommon that typically affects the long bones, especially through the knee region. This tumor are also a non-cancerous type, but it can be destructive and may have a tendency to recur. The cause of giant cell tumor is the joint pain, swelling, and limited movement, and can be located through our knee region.
Hammer toe. It is a change in position of the toe joints that toe takes on a claw-like appearance on the first protrude upward, causing irritation and pain on walking. Hammer toe are so named because the toe resembles a hammer with the joint is stuck an upward position. This deformity can cause pain and difficulty walking, and a corn or callus may appear on the top of the joint. A joint going rigid, pain at the top of the bent toe, and swelling are some of the symptoms of hammer toe. Hallux valgus, a painful condition involving lateral displacement of the great toe at the metatarsal joint. There is also enlargement of the metatarsal head and bunion formation. A hallux valgus is a complex deformity of the first ray of the forefoot. This deformity at times red and painful and can disrupt daily activities. Heberden nodes, a small hard noodle formed in the cartilage of the distal finger joint in osteoarthritis. It is described as a bony swelling that formed the hand as a result of osteoarthritis, and is a sign of osteoarthritis caused by the breakdown of cartilage at joints. Hemarthrosis. It is a bleeding into a joint cavity, which means this can occur after an injury or more commonly in bleeding disorders such as hemophilia. When we say hemophilia is the bleeding disorder in which the blood does not clot properly. If the patient will typically present with pain, swelling, and a decreased range of motion of the involvement joint. Next is leg calfaritis disease. It is the degeneration of the femur's proximal growth center. The bone is eventually restored, but there may be deformity and weakness, most common in young boys, also called coxa plana. When we say leg calfaritis disease is a rare condition in which the ball-shaped heads of the thigh bone or the femoral head temporarily lose its blood supply. Multiple myeloma, a cancer of blood-forming cell in the bone marrow, meaning is a cancer of the cell that produce antibodies, the plasma cell. It is impaired production of red blood cells, white blood cells, and platelets. Next is neurogenic arthropathy. It is a joint disease caused by impaired nervous stimulation, most caused in diabetes mellitus or the Charcot arthropathy, meaning is a rapidly destructive arthropathy due to the impaired pain perception and position sense, which can result from various underlying disorder. Osgood-Schlatter disease, caused by inflammation of tibial tuberosity where the patella ligament or patellar tendon insert. OSD is degeneration of tibia's proximal growth center causing pain and tendinitis at the knee. When we say OSD is an overuse condition or injury of the knee that causes painful bump and swelling on shiny bone below the knee, typically affect kids. Also, it is natural cause of anterior knee pain in adolescents that age to 10 to 15-year-old, mostly in males. OSD usually affecting only one knee, but it can be bilateral too. Osteochondroma is an overgrowth of cartilage and bone that happens at the end of the bone near the growth plate. Most often, it affects the long bones in the leg, the pelvis, or the shoulder blade. Osteochondroma is the most common non-cancerous bone growth. It most often occurs between ages 10 and 30s. The cause of osteochondroma is unknown, but the tumor is thought to be related to an abnormality in the growth plate, causing a bony prominence to grow away from the bone. As you can see in the middle photo, an osteochondroma looks like a bony projection on the external surface of a bone, like a bony mushroom on a stalk, usually near a growth plate area. It can occur in many bone, but it's seen most often around the knee or upper arm.
The tumor generally grows with the child and stops growing once the child completes puberty. Osteochondrosis is a term used to describe a group of disorders that affect the growing skeleton. Osteochondrosis is a self-limiting developmental derangement of normal bone growth, primarily involving the center of ossification in a epiphysis. It usually begins in childhood as a degenerative or necrotic condition. By definition, osteochondrosis is an aseptic ischemic necrosis. Osteodystrophy is a medical term used to describe abnormal changes in the growth and formation of the bone. It is most commonly the result of chronic kidney disease. In children, osteodystrophy can cause bone malformation and short stature, while adults may experience brittle bones and fractures. For example, osteomalacia, the bone tissues breaks down, but new bone doesn't form, leaving it spongy and weak. Osteomalacia, as you can see in the middle peak, that's what we called osteomalacia. Her leg deformed. And sometimes the formation of the bone can be look like letter C. Osteogenesis imperfecta is a genetic or heritable disease in which bones fracture, break easily, often with no obvious cause or minimal injury. Osteogenesis is also known as brittle bone disease, and the symptoms can range from mild with only a few fractures to severe with many medical complications. Osteogenesis is caused by defects in or related to a protein called type 1 collagen. Collagen is an essential building block of the body. The body uses type 1 collagen to make bones strong and to build tendons, ligaments, teeth, and the whiteness of the eyes. Certain genes changes or mutation cause the collagen defect. Osteoma is a new piece of bone usually growing on other piece of bone, typically the skull. When the bone tumor grows on the other bone, it is known as homoplastic osteoma. When it grows on other tissue, it is called heteroplastic osteoma. An osteoma is slowly growing bone tumor that typically forms in the skull or facial bones. It consists of a hard bony mass or growth. Osteomas are usually asymptomatic and may not require treatment unless they cause discomfort or other complications. Lastly, reactive arthritis, formerly referred to as Reiter syndrome, is a form of arthritis that affects the joint, eyes, urethra, the tube that carries urine from the bladder to the outside of the body, and skin. It was previously called Reiter syndrome, named after Hans Reiter, who first described this syndrome. Today, it is believed that the disorder is due to an aberrant autoimmune response to a gastrointestinal or genitourinary infection caused by Salmonella.
Spondylosis. Degeneration and ankylosis of the vertebra resulting in pressure on the spinal cord and spinal nerve roots, often applied to any degenerative lesion of the spine. Spondylosis is a condition in which there is abnormal wear on the cartilage and bones of the neck cervical vertebrae. It is a common cause of chronic neck pain. Spondylosis is caused by chronic wear on the spine. The most common cause of spondylosis is the cumulative joint stress that occurs as people age. It predisposes them to osteoarthritis, a common form of arthritis typically associated with progressive wear and tear on joint cartilage. Spondylosis may also arise as a result of previous trauma to the spine. Next is subluxation, a partial dislocation. A subluxation is an incomplete or partial dislocation of a joint or organ. According to the World Health Organization, a subluxation is a significant structural displacement and is therefore always visible on static imaging studies such as X-rays. Subluxation is the medical term for a partial dislocation. You have a subluxation if something pulls your joint apart and the bones still touch, just not as completely as usual. A subluxation is frequently caused by physical trauma, and most of us think of examples that range from car crashes to skiing accidents. However, a spinal subluxation can also be caused by something as simple as sleeping in an awkward position. Talipes, a deformity of the foot, especially one occurring congenitally. Talipes, also known as clubfoot, is a congenital condition that affects the alignment and position of the foot. It is characterized by the inward or downward turning of the foot, making it difficult or impossible to place the sole of the foot flat on the ground. Talipes can occur in one or both feet. The exact cause of talipes is not fully understood, but it is believed to be a combination of genetic and environmental factors. It may be present from birth or identified during prenatal ultrasound examinations. Other factors that may contribute to the development of talipes include abnormal positioning of the baby and the womb, musculoskeletal abnormalities, and neuromuscular disorders. Next is valgus. Bent outward. Valgus is a term used to describe the abnormal alignment or positioning of a body part, such as joint, away from the midline of the body. In the context of the foot, valgus refers to the inward deviation of angling of the foot away from the midline of the body, causing the arch to collapse and the ankle to roll inward. Valgus can be present at different joints in the foot, such as the hindfoot, rear foot valgus, midfoot, or forefoot. It can occur as a result of various factors including genetics, abnormal foot biomechanics, certain medical conditions such as arthritis or neurologic disorders, or previous injuries. Next is varus, bent inward. Varus is the opposite of valgus and refers to the abnormal alignment or positioning of a body part away from the midline of the body in the opposite direction in the context of the foot. Varus refers to the outward deviation or angling of the foot away from the midline, causing the arch to raise and ankle to roll outward. Varus can also occur at different joints in the foot, such as the hindfoot, midfoot, or forefoot. Similar to valgus, varus can caused by various factors such as genetics, abnormal foot biomechanics, medical conditions like arthritis, or previous injuries. Von Recklinghausen disease, loss of bone tissue caused by increased parathyroid hormone. Bones become decalcified and deformed and fracture easily. Von Recklinghausen disease, also known as neurofibromatosis type 1, NF1, is a genetic disorder that affects the growth and development of nerve cells in various parts of the body. It is caused by a mutation in the NF1 gene and is characterized by the development of tumors on or underneath the skin as well as various other symptoms. Common symptoms of von Recklinghausen disease include multiple brownish spots on the skin. Next is skin neurofibromas, soft fleshy growths on or underneath the skin, freckling in the armpit or groin area, and leash nodules, tiny harmless bumps on the iris of the eye. Additionally, affected individuals may also experience skeletal abnormalities like scoliosis or bone deformities, learning disabilities, and an increased risk of certain types of cancer.
So that concludes our discussion about the clinical symptoms and disorders of the skeleton.